Hello guys, once again Ijaz Hidayat is with you, and today we have a question by Samim Tamana. The question is what are the factors considering for the pregnant lady if we are going underwent for we plan to go for the cardiopulmonary bypass. So we will going to highlight some points related to the perfusionist, and before we'll start our topics. It's humble request to all of you to subscribe my channel, like my channel, comments, and share among the perfusion community. And this is the platform where you can discuss and learn the allied health professionals topics. So today's question is as per the Samim Tawana, the factors considered during cardiopulmonary bypass for pregnant lady. So I will try to highlight some points related to the perfusionist. So we have few points which we need to be discussed and need to be learned, and the first is the pressure. So we have to be make sure the mean arterial pressure during cardiopulmonary bypass, especially for the pregnant lady, should be above than 70 millimeter per mercury. It should not be lower than 70 per millimeter per mercury. And one thing I need to highlight that the first trimester ladies is not ideal for the surgery, but for the second trimester, yes, patients is suitable for doing the cardiopulmonary bypass in case if they require to go for the surgery. So first point is the pressure. So pressures should be the range of 70 to 80 millimeter per mercury. It should not go more than 65 millimeter, because in the scenario of the pregnant lady, you are perfusing not only the mother but to the fetal also. So always keep the pressures on 70 to 80 millimeter per mercury. Second point is the cardiac index. So the flow. So flow usually we are maintaining with index of 2.4 liter. So here we always keeping 2.5 to 3 liter per minute per meter square in cardiac index. So the flow should be like super normal as compared to the normal flow. So we always keeping like at with index of 2.5 to 3 liter per minute per meter squares. Third point is the depth of the temperature. So we avoid to do the hypothermia. This type of patient we always doing keeping the normal thermia, or if you require you make it a mild drift or mild temperatures like 32 to 35. It should not go more than 32. If you go more than 32, if you're doing the hypothermia, which is going to be keeping compromising of the uterine blood flow. So to avoid to compromising the uterine blood flow, so keep the normothermia or make a drift temperatures like a mild temperature like 32 35 degrees. Number 4 point is your hematocrits or hemoglobin. So usually we are keeping hematocrit on pump is like 20 to 25 is the suitable, but for these type of patients having the pregnant lady for bypass, we always keeping crit above than 28. 28. So I mean we always keeping above than 9 gram per deciliter during the cardiopulmonary bypass. During the cardiopulmonary bypass for patients like pregnant ladies patients. But to keeping higher hematocrit will helping to better oxygenation capacity, carrying capacity, which is going to help the tissues, supporting to the tissues of the maternal and even to the fetal. And fifth point is your acid base balance. So the recommendation is use alpha stat, not a pH stat. With the help of the alpha stat management, the maternal and the fetal pH should be maintained within a normal levels like a 7.35 to 7.45. So the consideration is to do the alpha stat, not a pH stat management, to avoid the any volatile situation, so to keep normothermia or keep the acid base in with alpha state management, not the pH state. As you know, the in a pH state management we maintain the blood gases with the actual temperature, where you require to add sometime, especially in cases where you have to add to CO2 to manage the pH PCO2 level. So in these type of cases, always do the alpha stat, so where you don't need to add any extra CO2 for the during the cardiopulmonary bypass. So the sixth point is your the pulsatility of the flow. Usually in routine bypass we are using the non-pulsatile flow, but if there is any way to create a pulsatile flow, it is better as compared to the non-pulsatile flow to perfuse fetal circulation and even to maternal will be more better in a pulsatile flow. But it depends if you have any facility of to create a pulsatile flow during the bypass for the pregnant lady. So what are the main factors we have discussed? Number one is your pressures. Pressure always be on a 70 and above, 70 millimeter per mercury and above. Number two point is your flow, and so mean cardiac index during the cardiopulmonary bypass as a perfusionist. So keep the cardiac index like 2.5 to 3 liter per minute per meter square. Okay. Number 3 point is your temperatures. Always try to keep temperature normothermia, or if you need to decrease temperature, keep it like a drift temperatures like a 34 to 35. Don't go beyond the chance of compromising of the uterine blood flow. Number fourth point, as we already discussed, is your hemoglobin hematocrit, always keeping 9 gram or 28 carat and above, which will helping to carrying capacity of the oxygenation will be more better. Number fifth point is your acid base balance, and always use the alpha stat management. Number sixth is your flow, pulsatile flow versus non-pulsatile. Mostly we are using the non-pulsatile, but if there is a possibilities like the machine, Atlang machines having the capability to create a pulsatile flow, try to make it a pulsatile flow, which is going to help to decrease the PVR of the patient and increase the blood flow of your fetal and even to the maternals. So the number 7 point is your PO2. So always keep a PO2 around 250 and 300, so not go more than 250 and below, because you are perfusing not only to maternal, you are also perfusing to the fetal during the cardiopulmonary bypass. And there is a positioning of the patients, like you always keeping the tilting from the left side up, so to right side up, to avoid there is obstruction in the SVC or IVC cannulations, and if chance to avoid to get any obstruction of the venous drainage. So always keep a good venous drainage by keeping the positions, the patient's position proper. You can use the vacuum if you require to maintain a good flow, but it depends on your the venous drainage. So these are the few very important steps which we have to take as a concentration, as a considering points during the usages of the cardiopulmonary bypass Hartlung machine. And as a perfusionist, you are the main co-pilot, you are a pilot of the Hartlung machine. So by keeping in your mind these 6-7 points, you can perfuse patient in a better way, and you get a good outcome result of the pregnant lady during the bypass. Guys, hope you like this video, you understand this video, and this video is going to help to give a good perfusion the pregnant lady. If you like these points, if you like my video, please share, comment, and I'm waiting for your positive or negative comment, because this is the real platform where you will learn something, and our target is to enhance knowledge, and this is a purely clinical based channel where we discuss all the points which we do in a routine. This is not only the bookish, it is like a clinical experience during our 20 years experience, and I want to share among you. So there is I'm always happy when you give the good feedback of my videos. Love you all. Have a nice good day. Enjoy your day. Bye bye.